everyone. I'm Sherry with the CGH Health Foundation, and welcome to our Growing Healthier program for September. This educational series is sponsored by the CGH Health Foundation, and in our Growing Healthier programs, we try to educate you about important health topics, as well as introduce you to some of our providers, and it gives you a chance to get to know them a little better. Our programs are hosted by Dr. Bill Bird, who is our Chief Medical Officer. Today's program is called Building Better Emergency Care, and Dr. Bird's guest is Dr. Desiree De Lemos, and she is the new medical director of the emergency department. And they're going to be talking about ways that we're working to improve your experience in our emergency care. And we'll get to that discussion in just a moment. First, I want to tell you what next month's program will be, and that is coming up on October 3rd. And we're going to be talking about breast cancer, which we often do in October. And Dr. Bird is going to be hosting our breast health navigator, Laura Leal, and our oncology nurse navigator, Sue Hagman. They're going to be talking about the screening and imaging services that we provide for breast cancer detection and the ways that we support and guide women through that breast cancer experience if they are unfortunately diagnosed with breast cancer. So that program is going to air again on Thursday, October 3rd at noon here on Facebook. I also want to remind you that the CGH Health Foundation's Delicious Design Auction is coming up, and it is a virtual auction, so you actually go online and do your bids. The bidding will start on October 17th at 8 o'clock, and it ends on October 22nd. And this year, we're going to do something a little different in that we're going to give you a preview of the auction items. We're calling it our Shopitizer. And that's going to happen the evening before the auction opens. So on October 16th from 4 to 6 p.m. here at the Health Foundation offices. And you'll get the opportunity to come and take a look at the baskets and see exactly what's in them. We're going to have snacks and prizes, and you'll get to meet some of our volunteer committee and staff for the CGH Health Foundation. Think that's everything I have. I know Dr. Bird's waiting out there in the wings to talk to Dr. De Lemos. Are you ready, Dr. Bird?
I am ready, Sherry. Are they going to get to meet you as well?
I think I'll be here. Yeah, I'm sure they're just waiting.
Oh, I know. You're celebrity status, Sherry. So I think you're going to be a big draw. All right. Well, thanks, Sherry. Hello again. Yes, I'm Bill Bird, Chief Medical Officer here at CGH. Thank you for taking the time to join me today. And today we're going to talk about our emergency department, in particular, our medical staff in our emergency department. And I thought the person that probably should be talking to us about that is the new medical director there, Dr. Destiny De Lemos. So Dr. De Lemos, let's get you on screen with me here. Hello.
Hi there.
Welcome.
Thank you. I'm glad to be here.
Yeah, glad to have you. All right. So I have a few questions I just thought we should ask so that folks could hear a little bit more about you and your experiences and your vision for our emergency department. So without further ado, what do you say we get going?
That sounds good.
Okay. All right. I'm going to start with something pretty simple, and that is, can you tell us, the folks that are watching, a little bit about yourself?
Sure. So I grew up in Southern California, right around the San Diego area, where I had all of the typical Southern California upbringing, which consisted of lots of beach trips and some really good Mexican food. And then I decided I needed a white Christmas. So when it came time for college, I kind of bucked some family tradition and moved to the Midwest and attended Notre Dame, where I did my 4-year college degree. Then I attended med school in Chicago. And then after that, I did my residency at University of Michigan, and then was recruited here to the Midwest again for my first attending job. And I've been here ever since. I have been in the Midwest basically since 2003, and I love it. I don't really see myself leaving. I feel pretty at home here, and have been working in emergency medicine and in emergency rooms close by, and then at CGH since March.
Very good, thanks. So speaking of emergency medicine, what was it about emergency medicine that when you were, going through medical school and deciding on what you wanted to do as a specialty, what drew you to emergency medicine?
I've always had a heart for taking care of all patients from every walk of life, of every age, of every background. And I also really loved everything about medicine. I was just a very eager, enthusiastic medical student. I loved all of my rotations. So I knew I wanted to do something that was more of a general specialty where I got to see all different types of patient presentations, all different types of disease. And the ER is kind of perfect for that. And I also really like the fast-paced nature of the ER. I like the variety of it. I like going, in one room and saving someone's brain who's having a stroke, and then going into the next room and helping someone who's in a mental health crisis, and then the next room, a trauma patient. I love just all that variety. In any given shift, you're caring for, maybe 30 different types of patients, which is amazing.
Yeah.
And then I'm a little bit of an adrenaline junkie. I like roller coasters. I like scary movies. And if you've seen, any ER centered program, whether that be ER or Grey's Anatomy, you can kind of sense that, the ER is just, you don't know what's coming in. You can go from, a pretty relaxed day to a day that is really exciting in a short period of time. So it's fun. I think the ER is just fun.
Yeah.
And then I think we have a big role in providing equitable care, because it doesn't matter who you are. It's come as you are. We'll take care of you. And so we can take care of all members of our community, regardless of their background. And I just love that. I love meeting new people, and I love taking care of every person. So
Right.
it's the perfect fit for me.
That makes a lot of sense. And it also makes a lot of sense why I don't do ED, because I am not adrenaline junkie and I don't like scary movies. So that's probably why I did family practice.
Yeah.
But I do like to see all people that want to show up. So that's the fun part about what I in family practice. So, okay.
Yeah.
Hey, what made you decide? So there's ED and then there's ED leadership. You're the medical director at CGH and have had leadership positions for a while now. What made you decide you wanted to put your toes in the water in terms of doing ED leadership, Destiny?
I think my natural personality type is to want to fix things. When I see problems, I like to be an active participant in coming up with solutions for those things. And when I was a resident doctor, I worked in multiple care settings, and I kind of saw changes that I thought would really positively impact patient care in those hospitals. So I knew when I was when I was graduating from residency, that I wanted to have a role where I would not only get to take care of patients, but also be able to be an active and engaged person in fixing those things and improving those problems. And if you talk to people that know me really well, that's one thing they'll say, is that she likes to solve problems. So, I'll tell you a story. I had a friend who lives in a wooded part of the Quad Cities, and these baby raccoons fell out of the tree and onto the ground. And she was like, I don't know what to do with these raccoons. And I was the first person that she called, not because I know anything about baby raccoons, but because she knew that I would know how to figure out what to do. And we did. We found a rescue, and they took the baby raccoons in, and they're still doing great. So, I like to solve problems. I like to be engaged in the things that affect our practice. And so leadership really gives you that opportunity. And then it also gives you an opportunity to set an example for staff and for your colleagues of kind of what you want, how you want care delivery to look. So I try to set an example in our department for how I want care to be performed, and I can mentor and lead others to kind of achieve those goals. And I find that extremely rewarding.
Yeah, I can see that. Matter of fact, when you say that, I know that when our marketing team was telling me when they posted that we were going to be doing this interview together, that one of the folks you had taken care of sent a very nice comment on Facebook about, oh, here it is. Yeah, so I thought I would this was a good time to share that little thing
That is so kind.
Yeah. So anyhow, yeah.
Thank you for whoever sent that.
Yeah. So what drew you to CGH?
I found CGH when I was learning and researching, CGH's mission and values. I found it incredibly inspiring that CGH is an independent health system and governs itself, and and makes decisions which are in the best interest of our specific patient population. And, I thought that was refreshing because I see the opposite happening in so many other hospitals. What we're seeing is kind of multiple rural hospitals in our area and nationwide are kind of being taken over by larger entities. And when they get swallowed up by those entities, sometimes that results in those hospitals in those smaller areas having less influence, and the decisions are made on a larger level. And I often think that that actually depletes care in those smaller areas. So it's nice to be in a setting where, we can still have autonomy and make decisions for the Sterling area and the Rock Falls area that will benefit patients in our community. And that I, as a physician, can be actively involved and make a difference in those, and because I'm involved in the decision making. And then I just really, growing up in a bigger city, I like being part of a smaller community because it's just so nice. People are friendly, people are engaged in their own healthcare, and I think the community really values and supports its healthcare providers, which I definitely appreciate. So, there are multiple reasons I came to CGH, but I'm happy here. I think that, we're doing so many great things for this community, and I think we'll continue to do that despite the challenges that we're seeing in rural healthcare throughout the country.
Yeah. Yeah, thank you. So speaking of challenges, I thought I would just give you an opportunity because Dr. Jalemos is really just now kind of getting her feet wet in terms of, beginning to help out with some of the things that any department that you're new to needs to problems to solve and things to change. What's working well in our ED right now, and what are some, as you look at the ED and you kind of been here now for a few months, what are some challenges that you see yourself working with nursing leadership to improve on?
Yeah, so I think one of the things that stands out, and I've been in many ERs throughout the area and throughout the country really, is our ER facility is just a beautiful, high, up-to-date, modern emergency room. Our facility is outstanding. We have, in terms of the physical plant, we have everything we need to be successful as an ER. And the other thing that's working really well is we are building a very strong provider group. So, previously the ER provider group had been outsourced to a more national organization. We're now building a provider group where we are all committed to being here in this community, and we are all employed by CGH. And so what that's doing is we're building a community of physicians with a strong dedication and a strong, we want this to be a great place to receive ER care. And I think the community will feel that difference. ER physicians are in a very high shortage throughout the country. And so we are very fortunate in that we just recruited our last two positions. Dr. Payton started at the beginning of July, and Dr. Bertucci, who is also ER residency trained, will be starting actually today. It was his orientation. So those two will kind of round out our group. And I think, we are very fortunate to have recruited these providers to the area. So I'm super excited about that. And then I think one of the things that makes the ED slightly unique in healthcare is that the ED is really has to function as a team to be successful. So every member of our team, from our housekeeping staff to our CNAs, our nursing staff, our registration team, our case managers, and our providers, we all work very closely together to care for patients. And our group really supports one another's efforts. So I really think that's working well as well. Our ED is not immune from many of the challenges in the post-COVID world that are affecting multiple entities in healthcare. So we struggle at times with throughput, which means we struggle to move patients through the ED in a timely manner. And that's for many, many reasons, but we're working on that from a multifaceted approach. Improving patients' throughput through the ER, which means how quickly they go from presenting to the ER to being discharged, admitted, or transferred. Improving that throughput and making that more efficient will allow us to reduce our wait times and improve the care that you receive when you come to the ER. And then we're continuing to evolve and expand our protocols and our care strategies on things like stroke and heart attack to be at the top level for those things as well. And then we're also trying to build a positive culture to make sure that we're cohesive in our care and to foster accountability so that every member of your care team takes ownership and value of your care and make sure that we're all working together effectively to deliver the best care to you. So those are all things that we're working on, that we've actively put efforts and energy into improving in the ED. And as time goes on, we'll develop further things that we think need to be enhanced as well.
Yeah, speaking of as time goes on, what you kind of hit on this somewhat already, Dr. DeLemos, but what's your long-term vision for our ED at CGH?
Yeah, I want us to be, an amazing ER. I want our department to be quality, to deliver quality care, to be efficient and to be well run so that I have confidence that anyone that I send, any family member of my own is going to go there and I'm going to be 100% confident that every member of the team is working together to deliver excellent quality and compassionate care. And a lot of that is leadership based. We have to model what we want staff to do. And some of that is just continuing to foster a positive culture. And those are things that we are working together to actively pursue and deliver.
One final question for you. What's your favorite thing about working here at CGH in the ED?
I mean, I just love caring for patients. I love it. I feel a sense of pride that our patients come into the ED. Some of them are coming on the worst day of their lives. And I feel so honored that they entrust me with their care. I mean, that is a huge privilege. I love coming into work, at night and knowing that I might be the only doctor in any ER within 30 miles. And that excites me. I love being an ER doctor. I love being able to positively impact our ED as a leader. I mean, I know that this is the career for me, and I love and am honored that I'm given the opportunity to do that every day. I think it's cool. Yeah. So I love being a doctor.
Great, thanks. Speaking of Dr. Bertucci, we're going to have lunch with him pretty soon here, aren't we?
Yes.
He literally is his first day. So looking forward to spending some time with him and have him join our team as well. So Dr. DeLemos, thank you so much for taking the time to just have a conversation about our ED and our ED services, and great to have you in your role and leading our department in a really positive direction.
Thank you for having me.
Okay, well, that was great. I have a few more things I want to share before I let you all go. Amara Campos is our employee of the month for the month of September. Amara is an RN in our oncology department, and we were up there yesterday to present the award to her, and the testimonials in terms of the work that she does were outstanding. So glad for her that she received and is getting recognition for the work that she does. Speaking of our employees, also we want to thank our employees. We have Employee Appreciation Week, the week of September 16th through 20th. So looking forward to that. We'll have a lot of events going on during that week. I like this Halloween thing going on here with the blood drive. It sounds like you can get this maybe as a t-shirt if you go there. I don't understand all the details, but our marketing department was explaining to me that you get some credits somewhere to potentially get this t-shirt. So yeah, continue to give blood if you're a blood donor, and if you're not, think about it. And finally, I think Sherry already mentioned this, but next month, Laura and Sue are going to be on with me, and we're going to talk about breast cancer detection. Laura works in our diagnostic imaging department, and part of her role there is as a nurse navigator. And Sue works in our oncology department, and her sole focus is as a nurse navigator for cancer patients. So looking forward to talking to both of them next month. All right. Well, hey, thank you for taking the time to watch this broadcast. If you enjoyed it, please feel free to share it with others. Until next month, thank you and have a good day.